Welcome again to another installment of the Medical Director's Minute. I'd like to take this opportunity to talk with you about patient identification. Most of you have probably heard this speech, but I wanted to use this modality to make sure that we reached as many of the providers in the Cape and Islands region as possible. But I wanted to speak to you today because in the last few months I had the unfortunate situation of having to inform a close friend that his mother had died. And quite frankly, I found out 8 minutes later, after he was already on his way to the hospital, that the patient was not in fact his mother and had been misidentified. This whole error was due to mainly a number of errors, both in the EMS and ER realm. And I hope that it is a lesson I hope that it's a case that teaches us the lesson that we have to be sure on who our patients are, and we have to do everything we can to identify the patient when we're on scene, because ultimately a patient cannot be accurately identified unless the patient's able to give you a name and date of birth, or a close family member or friend can do the same. Otherwise, I think identification should be done based upon on-hand photo ID, or identification should be handled by police. And if you cannot assure a patient's ID by one of these methods, I ask that you identify the patient as a John Doe and allow for further confirmation to happen once the patient has reached the hospital. Again, there is nothing more disconcerting than making an improper notification, especially with a critically ill or dead patient. And it is not something that I ever want to do again. And I hope that moving forward, that both us at the hospital and you guys in the pre-hospital setting will do everything possible to accurately identify patients and to heavily question when and how identification is made on patients that cannot identify themselves. Thank you again, and look forward to speaking with you in the future.